Of course.
Let's not let the facts get in the way of a good argument or a good conversation. But the fact is that 72 million Americans are having great difficulty paying their medical bills as of November of last year. About 47 to 50 million Americans have no health care coverage at all. But let's not let the facts get in the way. And I certainly appreciate Chairman Over reassuring the people in Japan, if they're looking in tonight or this morning for them, you know, they've got it pretty good in terms of health care coverage. And our friends in Europe understand that, you know, they don't have to worry about getting sick. My way of thinking is, as a physician, if you're sick, you should have the reassurance that when you're sick, you're going to have the coverage that means you're going to be in your house, not the poorhouse. If you're a citizen, you should be in the risk pool. It should be just that simple. If you're a citizen, you ought to be in. And if it's in your body, it ought to be covered. We have to find a way to make certain that that works out. And before I turn and yield to somebody else here in this discussion, not everyone agrees with all these ideas. That's why we have a debate. Here's a person from De Pere, Wisconsin, who says, quote, "I do not want the government involved in health care. The government mismanages money and thinks funds are endless," close quotes. So you see, we have to reassure our citizens, not just in De Pere, but that good government can make a positive difference in your life. Medicare was a tremendous program when it was first initiated. 16 to 1 was the ratio, people working versus retired. Now it's down to about 4 to 1. So there are some things that we have to talk about. Is Medicare sustainable in its current model? It's a great challenge. And can we somehow tease apart and differentiate our economic recession from our ability to pay for our health care costs? I don't think so. People in my district are telling me, Kagen, health care costs are just impossible. Small businesses, what are the greatest components of their overhead? Energy and health care. And that doesn't matter if you're on Main Street, on Wall Street, or if you're a family farmer in northeast Wisconsin. So we have to attack the greatest cause of bankruptcy today in the country, which is the high cost of medical care. I'm confident that we're going to be able to work out some details to guarantee that if you're a citizen, you're in, that there'll be no discrimination due to pre-existing conditions, that the price for health care services, for hospital services, for your pills and prescription drugs will not be whatever they can get. It won't be whatever they can get. It'll be whatever they openly disclose and give every citizen that